My name is Dr. Bach. I am a neurologist at Northwest Neurology Memory Clinic, and I would like to today talk to you about sleep as it pertains to brain health and especially importance of sleep for memory. The two most feared diseases in developed countries are dementia and cancer. The Alzheimer's disease is a rapidly growing problem around the world, and it's becoming a global health problem. Currently, there's about 6 million Americans suffering from Alzheimer's disease, and the numbers are projected to double within the next 30 years. Similarly, around the world, dementia is a global problem, and the numbers are projected to triple within the next 30 years. Lack of sleep or sleep difficulties are becoming to be recognized a risk factor for developing Alzheimer's, dementia, and other dementias. Obstructive sleep apnea untreated and insomnia frequently are associated with developing dementia. We know a lot of associations between dementia and sleep. Sleep problems are highly prevalent in dementia. Patients with dementia are about 5 times more likely to have obstructive sleep apnea. 50% of patients with dementia have insomnia. REM behavior disorder has been recognized as a prodromal phase of several types of dementias, including Parkinson type of dementia, Parkinson's disease associated dementia, multiple system atrophy, and Lewy body dementia. Patients with Alzheimer's disease dementia have significant sleep disturbances, including fragmented sleep and disturbed REM sleep and slow wave sleep. As mentioned before, obstructive sleep apnea and insomnia are known risk factors for Alzheimer's disease and other all-causes dementia, up to 15%. Short sleep has been shown also recently to be a negative factor for future development of dementia. In the UK, about 8,000 adults were tested, and those who are sleeping less than 6 hours per night over 30 years had about 30% increased risk of dementia as compared to those who slept more than 7 hours per night. Sleep can be expressed as in an electrical activity on EEG recorded electroencephalogram. During the first hour of sleep, the brain descends into stage 1, 2, NREM sleep called light sleep, and then NREM 2, 3, and 4 sleep stage called slow wave sleep or delta sleep. And about 90 minutes into sleep, the electrical activity of brain reascends through the same stages to enter first phase of REM sleep. REM stands for rapid eye movement sleep and is characterized by profound atonia or relaxation of muscles, except muscles of respiration and ocular muscles. The stages of sleep are important. Each of them represent and provide benefits. Sleep has been recognized as a complex metabolically process. During NREM sleep, the blood pressure, respiration, and heart rate decrease, while growth hormone and glucose levels will increase. During the REM sleep, the brain electrical activity and cerebral blood flow increase, while, as mentioned previously, muscle tone is low, profoundly decreased, except the muscles of respiration and ocular muscles or eye muscles. You may ask, what has sleep to do with memory? And it turns out that recent days we have learned many new information about the correlation between memory and sleep. And sleep assists both in generation of short-term memory as well as long-term memory in a process called consolidation. During the day, the brain is acquiring new information, and all the new informations are being stored in a place called hippocampus in medial temporal lobe. The area of the brain has limited storage capacity, just like the USB memory stick. The short-term memories have to be moved to safe place in a brain for long-term storage called neurocortex. If you run out of space in the short-term memory storage area, you will not be able to add any new memories. And sleep assists in transferring of and refreshing, transferring memory from short-term storage to long-term storage, as well as refreshing of the short-term memory storage in hippocampus. Specifically, stage 2 and REM sleep with the generation of short bursts of electrical activities called sleep spindles are assisting in refreshing the short-term memory storage called hippocampus. Unfortunately, with aging process in the 60s and 80s, about 40% reduction in sleep spindles is observed in the brain sleep process. During the long-term memory acquisition called consolidation, the information from short-term memory storage are being transferred like a file transfer process to the long-term memory storage in the cortex. This has been shown to occur during a stage 3 and 4 NREM sleep, show the slow wave sleep. Slow wave sleep is reached in early stages of earlier in the sleep. So sleeping before learning and sleeping after learning will enhance the memory acquisition and refreshment of the short-term memory reservoir called hippocampus. Now, hopefully the information about short-term and long-term memory storage was helpful to you, and I would like to give you a few tips how to improve your sleep. You may increase your knowledge on sleep hygiene and healthy sleep, looking into the publication of NIH 12 tips for healthy sleep from 2012. But in short, it is helpful to stick to a sleep schedule. So going to sleep at the same time and waking up at the same time is beneficial. Trying to catch up with sleep on the weekend usually does not make up with the lost sleep during the week, and may actually cause you to have more difficulties wake up on Monday morning. Exercising is great, but not too late at night. You should probably exercise at least 2 to 3 hours before going to bed. It is helpful for good sleep to avoid stimulants such as caffeine or nicotine. Drinking at least only a cup of coffee late in the evening may delay your sleep at least up to 8 hours. Nicotine similarly may promote light sleep and then early waking in the morning due to withdrawal. Alcohol is known to reduce the REM sleep and also may cause difficulties with breathing during sleep. Avoiding large meals before sleep may prevent indigestion, and also drinking large amount of fluids may cause frequent awakings during the night. Some medications for blood pressure, over-the-counter allergy medications also may disturb sleep. Therefore, you might want to talk to your doctor about that. Taking naps late after 3 p.m. may delay sleep onset. Avoiding that may be helpful. Don't overschedule. Relax before bed. Taking a bath before bed may help fall asleep due to the drop of temperature that promotes sleep. In general, dark room, cool bedroom, and gadget-free bedroom helps with falling asleep. Um, Daytime exposure to light helps regulate the sleep-wake cycle, and exposure of minimum 30 minutes of daylight may help with good night's sleep. If you have difficulties with sleeping and not able to fall asleep within 20 minutes of going to bed, you may want to get out of bed and do something to relax and return to bed when you feel sleepy. I hope that was helpful, and thank you for your attention.